Hello there, all. Today we'll go into an important chapter, role of government in health. Okay. Hello, I'm Ananya. I'm your teacher for today. If you want to know more about me, just refer to the slides. Okay. And before I start with the chapter, if you are thinking that you are going a little away from the chapter, just take down a notebook and note down the important points. Keep the doubts aside, and after I'm done with the chapter, you can just put them down in the comment box. So, what is health? Health is a state of complete physical, mental, and social well being, and not merely the absence of disease or infirmity. So, health is when you are in complete peace, in mental, in physical weight, and everywhere in your social too. That is health. Okay. So, healthcare in India and what are the challenges and opportunities we face. Okay, so first we'll go into strengths, that is the opportunities. So there's a large number of medical colleges, doctors, hospitals, and medical production in India, which makes it it's easy to access health. Okay, it's not that hard. Then we have something called as challenges. What are it? There's unequal distribution of healthcare facilities with concentration only in urban areas, shortage in rural areas. There's only high out of pocket expenditure for healthcare, which makes it really hard to keep a track of where the expenses are going. Then we have something called as two pillars of healthcare. One is a public healthcare, one is a private healthcare. What about public healthcare? Public healthcare is government run healthcare systems which aims to be affordable and which is accessible to all, including we have primary healthcare centers, we have government hospitals, we have public health programs under that. Then we have private healthcare systems which is not government controlled. It's often expensive. It caters to those only who can afford for the services given by that. Okay, including private hospitals and clinics. So, what are the difference between public and private healthcare properly? First, we'll go through public. It's funded by the government. The taxes that we pay, it's funded by the government. Then aims to provide healthcare for everyone, regardless of whatever income they have. It aims to provide healthcare for all. It often has a longer wait system. It's generally lower cost or free at the point of service. What is the difference between a public and a private healthcare? We'll learn about it properly now. So, public healthcare is funded by the government or taxes. Okay? It always aims to provide healthcare for everybody, regardless of whatever income they hold. Okay? It has a longer wait line. Okay? Generally lower cost or sometimes even free. Okay, emphasis is on more about on preventive care and public health and etc. Examples you can take is government hospitals and clinics. What about the private healthcare? So always funded by a rich individual or private insurance company. It often has faster access, shorter waiting times for any appointments, typically more expensive, offers a wider range of specialized services and amenities. For example, private healthcares and private hospitals. Okay, then what is a model for public healthcare that we can take an example for is Kerala's success. Kerala has high life expectancy, low infant mortality, excellent public health indicators. How did they do this? They did that because they had investment in public health. They instead of making centralization for healthcare, they decentralized that. Their focus was more on primary care and high literacy rate, which made us take a model of Kerala's success. Then we have something called as health over military. We can look at Costa Rica. Costa Rica's choice abolished its army, invested more in health, education, and social services. Doing this resulted them as one of the healthiest countries in Central America with high life expectancy and low infant mortality. Okay? Then we have solutions for a healthier India. How can we make India healthier? So, increasing government spending on health facilities, improving basic amenities and social conditions, focusing on preventive healthcare and health awareness, strengthening public healthcare infrastructure, regulating private healthcare to ensure more affordability. Then, what can we make healthier India a shared responsibility among us? So, government's role is basically providing accessible, affordable and quality healthcare for all, right? So what as we citizens we can do is adopting to healthy lifestyles, participating in a lot of preventive healthcare solutions or healthcare meets, holding a government and not and holding government accountable for a lot of stuff. Okay, please refer to the link given below in the description. which is a link to the blog which will help you make your own notes. Like I said in the starting, before I leave you guys, I present before you two questions regarding the chapter we've covered. Those who answer it and put it down in the comment box will be given a special goodie from Paathshala. Okay. Questions are: how can you understand a healthy India is shared by its citizen and government? 2. What is your opinion on difference between public healthcare and private healthcare? In what aspect do you think that it should improve? Thank you all for coming on this beautiful journey. I hope you have understood the role of government in healthcare centers. Have any doubts? Put them in the comment box. As I told you, be curious, keep learning for more, keep earning for more, and want to learn more? Follow Paathshala. Thank you.